Well, hello again. This is Jason Renault with the Alternative Mobile Services Association. I'm speaking with Alena Maschke, who is the general manager of The Current, which is a news operation out of Lafayette, Louisiana. Hello, Alena.
Hi.
Thanks for joining me.
My
We're
pleasure.
going to talk all things Southwest Louisiana and mobile crisis. There's a lot going on, and we don't know about it, but we'd like to learn from you. But first, why don't you tell us a little bit about yourself and how you got into this position of knowing everything about mobile crisis in Southwest Louisiana?
Well, you might be overselling me a little bit there, but I'll try my best. Yeah, before stepping into the role as managing editor of The Current, which is a nonprofit newsroom in Lafayette, Louisiana. I was the health reporter for the Acadiana Advocate, which is the local office of sort of our state newspaper, which comprises the Times-Picayune in New Orleans, the Baton Rouge Advocate in Baton Rouge, the Acadian Advocate here in Lafayette, and also our office in Shreveport, Bossier City, which will cover sort of the main cities in Northwest Louisiana.
Well,
Um, yeah.
great, great. And you have been focusing on public health and public welfare.
Yeah, so as the health reporter for those two publications, I was reporting on health for about a year and a half, and a lot of that time I've been reporting on mobile crisis response. That covers different sectors of healthcare for us. So there are mobile crisis response efforts on the behavioral health side, as well as more recently, sort of urgent and primary care.
Great. So you recently wrote a story about what's things stirring in Lafayette. Can you walk us through from the beginning to where we are now?
Yeah, absolutely. So, Acadian companies, which some of your listeners, members might be familiar with, they're a really big company that covers ambulance services along with other emergency and home care services all across the South. They're in Louisiana and Mississippi and Tennessee. I believe they work in Georgia as well. And then Acadian Health, which is the sort of sub-company of Acadian companies that is working on this mobile crisis response effort. They also provide services in Minnesota and Wisconsin, I believe.
Hmm.
So basically what they did, what Acadian Health did, is they partnered with the Louisiana Department of Health and looked at who were the Medicaid patients that they considered super utilizers. So people who, by their definition of super utilizers, used the emergency room more than 9 times a year. The average among that population is actually a lot higher. So I think the average number that they came up with is these super utilizers that they were looking at were on average using the emergency room 17 times a year.
Mhm.
So they tried to find a solution that would create more opportunities for preventative services, for check-ins that might help divert these patients from the emergency room and instead give them care in a more appropriate setting.
Mhm.
And prior to them, their health situation escalating to the point where they have to use an emergency room.
So they're coming to this from a cost management perspective.
Yeah, I think they would argue that they're coming to it from a patient care perspective, but sure, there's certainly an aspect of that too. And so they have this unique partnership that they started with the Louisiana Department of Health, where they are able to receive reimbursement for those services being delivered at home. So Acadian Health normally is a home care provider, and that's the arm of the company that will be implementing this crisis response system. So the idea is that people will be able to reach out to their primary care doctor with whatever concerns they have. Often, from my interviews with them, often those patients have some sort of chronic condition that they need management of, but that might uh, lead to crisis-like symptoms in certain situations where they would want to be seen by a doctor immediately, and their primary care doctor might not always be able to offer that service to them. Anyone who's ever tried to get an appointment with their primary care doctor probably knows you don't get it the same day, most likely. And so the idea here is that instead, Acadian Health staff can go to the home and assess the patient at home to see if there's care that they can administer there, if there's symptom management that they can initiate there that would prevent that patient from going to the emergency room either that day or a few days down the line, right, when symptoms might worsen. So that's the basic concept.
That's great. That's a very interesting that it's coming from the home health care strategy of so they're very familiar with hiring and training and managing people who do in-home healthcare services.
Right. And I think the challenge there was probably to kind of sync that up with the Medicaid reimbursement system. And that's where the partnership with the Louisiana Department of Health comes in, is that they worked out sort of an arrangement where they can provide those services and it will be within the reimbursement schedule for that patient's Medicare,
And
Medicaid,
so
my bad.
what's the role of the Louisiana Health Department in this?
Well, so the Louisiana Department of Health basically has control over what services get reimbursed, right, through the managed care providers that offer our state's Medicaid programs. And so that's where they come in.
I see.
They also provided data. So they were the source of the data that identified which patients are best suited or would probably benefit most from this program.
And so this program is just for the super utilizers identified by the agency, or can anyone receive a
That,
service if they're in crisis?
my understanding is that they are the focus group right now. Yeah.
Okay.
So it's a subset of the overall Medicaid population.
And so it's limited to those individuals.
That's my understanding.
Okay.
Yeah.
And how would they, if they are having trouble, want to receive services, how would they contact the agency do they call 911 or 90 or the special number?
Yeah, so right now, the primary sort of point of contact would be their service provider. So the doctor that they're already working with. Again, the idea sort of being that that doctor might not be able to see them that day, but they can call into the office and then basically the doctor can make the referral to Acadian Health.
I see. So it's an immediate service to provide that in-home health care. Now, are most of these folks, are they identified as persons with physical illness or psychiatric illness or what sort of, do you have any idea about that?
I'm not 100% sure. What I can tell you is that there's a number of services that they're able to provide. There are some chronic issues like back pain, other chronic conditions that they anticipate to see a lot. We didn't specifically talk about mental health or behavioral health in this context, although I imagine that might play a role. Behavioral health crisis care and mobile crisis care for behavioral health has definitely been a big topic here in Louisiana as well.
Well, tell me about that. Tell me about how that conversation is widening out in your area.
Yeah, so going back a little bit, Louisiana is currently under a decree from the Justice Department that relates to providing appropriate care to patients with behavioral health issues or with severe mental illness specifically in a more appropriate setting. So to kind of summarize where that came from, the Department of Justice the federal government filed suit against Louisiana, accusing the state of basically warehousing people with severe mental illness in nursing homes and that not being the appropriate care setting. So in a settlement to that lawsuit, LDH agreed to create a better system of delivering care to those people and those patients. And so about a year and a half ago, they started rolling out a system of partnerships in the different regions in our state, basically to partner with local organizations to provide those services. And those services consist of four pillars, one of them being mobile crisis response. So that means giving people a resource that they can reach out to if they are in crisis, and someone will come to them and try and work through the situation with them, provide them with resources for additional care, and sort of alleviate the crisis in that moment.
Well, that's great. That sounds like they're seeing mobile crisis as being an ancillary service to allow people to live in a least less restrictive setting. This is sort of an extension of the Olmsted ruling from a few years back to allow persons to have the least restrictive setting possible.
Absolutely.
And have some of these teams already gotten up and running?
Oh, absolutely. Yeah. It's this effort has yielded mixed results.
Hmm.
Here in our area, we do not currently have a mobile crisis response team.
Hmm.
So in some areas where there already were a lot of resources, that's my impression having reported on this, it's been a little bit easier to get this off the ground because there are already providers there that were equipped to provide that sort of service. In other areas, especially in central Louisiana, in rural areas where there are already provider shortages, it's been a little bit more difficult. Central Louisiana comes to mind, Southwest Louisiana towards the Texas border, so Lake Charles. That region was really, really devastated by hurricanes and several other federally declared disasters in the span of about 6 months towards the end of 2020 and
Hmm.
2021. So there were two massive hurricanes, a winter storm, and a flood that led to a shortage of mental health providers in the long run. Lots of people left that area after
Hmm.
these storms, and that included specialists and providers of mental health care. So in areas like that, it has been more difficult for LDH to find organizations to partner with. In other areas, this has been going super well. I mean, I've heard from North Shore region, so sort of north of Lake Pontchartrain, uh, not far from New Orleans. There's a well-established provider network there that was able to create that kind of crisis response, stand up that crisis response system fairly quickly after the Louisiana Department of Health put out the request for applications. Again, in other areas, finding those partners has been a little bit more challenging. So the system hasn't been rolled out all across the state yet. It's sort of, it's in different phases of development.
And so these are teams that are dispatched by 911 or 988 and sort of work adjacent to police or adjacent to fire departments.
Yes and no. So they are sort of supposed to be a lone standing service
Hmm.
where, and that's been frankly in some areas the challenge. In our area, for example, we had a provider who wanted to stand up such a system and was having a really tough time um, getting referrals.
Hmm.
So one of the challenges of standing up that kind of system is that you need to make people aware that it exists.
Hmm.
We have had, since you mentioned law enforcement and first responders, so we've also had other efforts by local law enforcement specifically to create teams that will have a mental health trained law enforcement officer or mental health professionals on the immediate response teams. So if
Hmm.
someone, say, calls 911 and law enforcement responds, there have been attempts to also equip those teams with someone who is trained in or a professional in mental health care. Also, again, with mixed results. So if you want me to continue,
Yeah, tell
I
me something
can.
about some of those mixed results. That sounds a little interesting.
Yeah, so our police department, Lafayette Police Department, tried to set up a system like that. In that case, it was police officers who were who received specific training
Hmm.
to do sort of mental health interventions alongside with a police response. Unfortunately, they were facing an officer shortage. So a lot of these, I think they had a few. I can't give you an exact number. I'm sorry, but they had a few officers that were trained specifically for that purpose. But because they were short officers in general, they had to rotate those officers back into patrol. So
Hmm.
they, a few months after starting the program, announced that they had paused it. And as far as I'm aware, they haven't restarted it. The sheriff's department also set up a similar system that as far as I'm aware, is still in place. In that case, they specifically hired mental health professionals to go along with law enforcement officers on certain calls where the dispatcher, based on the information that dispatcher got, they feel like a mental health professional would be a good addition to that response. So it's all about resources in this case, and they are often short in Louisiana. So the mixed results are really all it seems like often a question of resources.
But the model that the state Department of Health is putting forward, that's a non-police model. Is that right?
Yes, so the partnership with Acadian Health does not involve any law enforcement. That and neither does the Louisiana Department of Health's crisis response system for behavioral health. Those have nothing to do with law enforcement. They are really directed at sort of a medical perspective, from a medical perspective.
Are these other co-responder teams, are they also sort of designated for a specific sort of person, a super utilizer of some sort?
No, you're talking about the law enforcement
Mhm.
teams. No, I think in those cases it has more to do with, the information that's relayed to the dispatcher and then relayed by the dispatcher to the responding officers. Basically, if it seems like a situation where there might be someone who is in a mental or behavioral health crisis involved, that's when that it would trigger a response that would include a mental health professional in the case of the Lafayette Parish Sheriff's Department.
So what does the community think about all these changes? Are there advocates standing up and asking for services?
Yeah, so I mean, one of the reasons why this has been a big area of focus for me as a reporter is because it seems to be an area of huge interest in our community.
Hmm.
There's been lots and lots of roundtables and meetings and everything to try and figure out how we can, especially in the behavioral health realm, how we can better serve people who need assistance. So there's clearly an interest in the community to make that happen. So I think overall, the response has been really positive. Um, Frankly, I think people want to see more of it.
More of the non-police response
Yes,
to
at
help
least in
people.
certain cases. Yeah.
Yeah, yeah. Cases where it makes sense to the dispatcher, where people aren't going to have to go to jail and maybe be able to get help in the field. Get help.
Yeah, so I did sort of a longer project as well about the long-term impacts of deinstitutionalization, specifically here in Louisiana. Obviously, that's
Yeah.
a trend that happened all over the nation over the past 60 years, right? Starting in the 60s, of sort of moving away from institutionalizing people in these state hospitals, state institutions. And instead, the idea was to serve them in the community, which I think is really sort of that's like the macro level of mobile crisis response, right? Like we're moving away from these big institutional settings that people were basically incarcerated in for having mental health issues to a more community-based setting. And then the next step probably is trying to treat them in their home environment if possible, or in the environment that they're in, rather than bringing them somewhere if possible. And so one of the unfortunate downstream effects of that deinstitutionalization has been that creating the community resources to catch that population that now doesn't have a state asylum to go to anymore has lacked. And so there really isn't an in-between for people to go. So a lot of people in mental health crisis end up incarcerated. Louisiana is already the state in the nation that has by far the highest per capita incarceration rate. We have for years been much higher than most countries. So we have an incarceration problem, and adding people who really have mental health problems that need to be addressed rather than, a long history of criminal actions. That's something that I think a lot of people want to see change, especially the family members and loved ones of those people, but frankly, anyone who pays taxes, right? I think there's lots of people who want to see that system work better for the community and for the patients. And I think mobile crisis response has been one solution for that.
Right. Not the only solution, but one. Now, the decriminalization of mental illness has been a long, struggling conversation. But in Louisiana, as you mentioned, it just has a horrible history of hurting a large number of people, especially Black men. Is there how is the Black community thinking about this? Are they participating in these community discussions? Are they leading them?
They're definitely participating. And especially like you mentioned, when it comes to the connection with incarceration. Like you said, Black men specifically are very, very affected by this and are being incarcerated at much higher rates. And a lot of the people that I spoke to, a lot of the families that I spoke to for this were, Black Louisianians who really often saw no other way to help their family member than to call the police.
Right.
And all of them said, that's not what I wanted to do. That's not how I would have liked to go about it, but I didn't know what else to do. And so they might not necessarily pinpoint mobile crisis response as the only or even a priority solution to them. They just want a solution. And that, I think, has multiple facets. It has, there's the aspect of just the need for more resources for inpatient care as well. But that all starts with connecting the people in crisis with the available resources in the first place. And I think that's a bridge that mobile crisis response can build. That's a gap that it can bridge.
Sure, sure. It's sort of last line of defense. That's a fascinating experience you're having, is listening to these people speak about this horrendous experience of calling police, knowing that the outcome could be terrible, but having no other option. Were there other sort of local solutions that you heard about, or other ideas about how to reduce this hospitalization or unnecessary jailing?
Yeah, so I mean, there are also efforts to just create crisis centers and more points of contact and resources for people to go to, even if maybe they don't have a mobile crisis response that comes to their house. But say I'm a mother to a son who struggles with substance use, with severe mental illness. Often those are co-diagnosed, is my experience from my reporting. And I need somewhere to go. That's not the coroner's office, right? Because that's in many cases, if it's not police, then these families feel pushed, and understandably, because there's not really that many other resources for them around, to go to the coroner's office and basically get their family member committed, which brings with it another sort of complicated process, both emotionally and administratively for the family and everyone involved. And so there is currently, this is also a fairly recent development, there is a plan to create a local chapter of Tulane's early psychosis intervention program.
Excellent.
Here in Lafayette. So that's a fairly new announcement. They haven't opened yet, but there are those efforts to also create sort of contact points, service resources for people in different stages of a mental health crisis to get them in touch with sort of the treatment that they need rather than wait until it gets so bad they do something that gets them arrested.
Or have some terrible experience that
Right.
becomes a barrier for them to getting future help. Giving resources to those family members, what to do instead of calling 911. So important. So,
Absolutely. And our law enforcement locally, acknowledges that. I mean, I've interviewed them on this. They're the first ones to admit, like, we're not the right people for this. Our correctional officers are not, we can train them, but that's not what they entered this field for. And that's not necessarily how their personalities work, right? Like they're law enforcement officers, they're correctional officers. They're not mental health professionals. They're not mental health nurses. But in many cases, they kind of are almost pushed into that position because people are brought to our local jail who are in mental health crisis. And they can't necessarily be housed with the general population because their mental health issues might prevent them from, doing well in that kind of environment. So it's a real challenge for local law enforcement and corrections as well. They're not set up for this.
Alena, thanks for your reporting. Thanks for your work. Thanks for talking to us. I hope we can check in again soon.